Hello and welcome to the Queen Elizabeth Patient Podcast. So I'm here today at the Proto building with Dr. Peter Blackburn, who is an NHS consultant in clinical psychology who works in oncology and palliative care. He's interested in acceptance, compassion, values-guided living. And we're here today to discuss why a good night's sleep is incredibly important for your health. In fact, I suppose it's just as important as eating healthy and exercising. Unfortunately, we're aware there's a lot that can interfere with natural sleep patterns, and probably we would say that people are now sleeping less than they did in the past. And sleep quality has certainly decreased as well. There's a lot of reasons why good sleep is important, and we're going to discuss this a little bit more with Peter today. Thank you, Peter, for coming along.
Firstly, thank you for inviting me. Sleep is fundamental to us. And it's not always about the quantity of sleep, but rather the quality of sleep. So we're going to look at some strategies for improving the quality of sleep. But firstly, let's just think about poor quality sleep. Poor sleep can be a consequence of worry, depression, anger, lots of emotional problems, but also physical health problems too, like persistent pain. Poor sleep can also amplify worry and anxiety. Therefore, if needed, improve the quality of your sleep. This can be done by establishing a regular sleep-wake routine, which means going to bed at roughly the same time each night, but more importantly, getting up at the same time each day. This is important because we have an internal body clock that needs resetting each day. Otherwise, it will shift quite quickly, such as when we have had a lie-in on a weekend, and then getting up at the usual time is harder on a Monday morning. Ensure that your bedroom is cool, quiet and dark, and that your bed is comfortable. Avoid using your bedroom as a workspace or a place to watch TV, as the brain gets confused, wondering if this is a study, is it an office, is it a lounge. It is a bedroom and it needs to know it's a bedroom. The purpose of a bedroom is principally for sleep and sex. And then thinking about other strategies, try to avoid large, heavy dinners late in the evening and snacks that may give you heartburn or indigestion. Some researchers suggest that a light bedtime snack in high tryptophans can help promote sleep, such as milk, bananas, cheese, and chicken are some of these foods. Have a wind down routine before bed. This means stop working or studying at least 30 minutes prior to going to bed. Spending this time enjoying a relaxing activity, such as listening to music or reading a favourite novel. When it's time to go to bed, hopefully you have that sort of heavy feeling of sleepiness is starting to approach, and that's the time to head to bed. And hopefully you'll get into a cool bed and fall asleep within 10-20 minutes maximum. If you haven't fallen asleep after 20 minutes, unfortunately you'll need to get up and go to another room and begin your wind down process. You'll need to begin your wind down routine again, which means doing something that is not stimulating, not watching TV that'll worry or excite you, or doing the ironing. It's a quiet, gentle activity that needs to occur, and this probably will last about 45 minutes to an hour, because that's how long arousal levels occur, and then there will be a dip for people ready to go to sleep. And once again, noticing that sort of heaviness that you get and gently taking yourself off to bed, and hopefully this time you'll go off to sleep. Should you wake up in the middle of the night, then avoid looking at any clocks, be it a bedside timer or the time on your phone, as both of these will potentially make you feel anxious that it's only 2 in the morning and you're never going to get back to sleep, and activate the sympathetic nervous response, which is about arousal and awakeness. So you'll need to just guess how long you've been awake, and once you think you've been awake for 20 minutes, go downstairs and do that wind down routine again, waiting for that feeling of heaviness to come, and that's the time to go back to bed. And it's a bit like surfers watching for that wave to surf on. We need to just be gently aware of when that wave of sleep is coming. Notice it and gently taking ourselves back up to bed and to sleep. If you want to lie in bed awake, then practice breathing exercises. Breathe in through your nose, noticing that sensation, noticing how when you breathe in your lungs expand, your tummy might move up too, and then will fall again as you breathe out. Just keep focusing on that cycle of breathing. Your mind might wander. Just bring it back again to focusing on your breathing. Another technique might be around how you spend a big lottery win. Another technique is about trying to keep your eyes open. As hard as that might be, try and keep your eyes open and will yourself awake, which is what's known as a paradoxical approach. And then when the alarm rings in the morning, it's about getting up. Don't be hitting the snooze function too often. Don't reset it for another hour. Remember, it's important to reset your body clock each day, and extending that lie-in will only disrupt that. Remember that regular exercise, just 20 or 30 minutes a day, preferably no later than late afternoon, will help with sleep function. Avoid, as we've said, foods that have got high sugar content, and avoid excessive caffeine use, making them maybe the last cup of coffee, cup of tea, around about 6 o'clock in the evening. If you still like cups of coffee or tea, then make it decaffeinated. Remember, chocolate has caffeine in it too. So having a piece of chocolate or a cup of hot chocolate will also have a stimulant effect. Also thinking of stimulants, remember that smoking tobacco is also a stimulant. Nicotine will affect the quality of sleep, and do not use alcohol as a sleeping aid. Many believe that a nightcap will help them fall asleep, and probably it will, but it will affect the quality of REM sleep, which means that you'll dream less that night and then have more disturbed sleep in the next night's sleep. And when alcohol use becomes chronic or excessive, then sleep will be severely disturbed. There are times when sleeping medication may be a benefit. This medication is intended for short-term use, so maybe only 2 weeks. The concern is that people will become dependent on this medication and will only be able to sleep with it. If you and your doctor decide that sleeping medication may be helpful, use it with caution, because it can have a negative impact on the following day's functioning, how you think, and also it might have effect on your body and you feel grotty. And remember, never mix alcohol and sleeping medication. This can be deadly. In terms of other sort of psychological techniques to use, if your mind is busy just with everyday life, or you're worrying, then have a notepad by the side of your bed and write down whatever's going on in your mind. And when that worry comes back, remind yourself it's on the notepad. There's nothing more you can do. It's there for tomorrow in the daylight to be worked on. I think it's worth noting that daytime sleeping, whilst it's tempting, can be counterproductive. It's counterproductive because it ends up robbing from the night to come and will disrupt the night to come sleep, the quality of it and quantity. So if you're going to sleep during the day, the advice would be make it before 1 o'clock in the afternoon, no more than probably about 20 minutes, and sit upright, sleep upright in a chair. Resist the temptation to lie horizontally on the sofa in a bed, mainly because you're more likely to go into a deeper sleep, and that's the deeper sleep we want to avoid during the day, because that will rob from the night to come. What you're aiming for is a power nap.
So thank you very much, Peter. That's been really, really informative. There's just a couple of things as well. Can you just discuss about, of how many hours, should we be sort of aiming for? I know it'll be different for each and everybody, but is there any sort of goalpost that we should be going for?
Yeah, I think that there are some rules of thumb rather than it being cast in stone. Research will suggest a variety of things. It'll always come back to quality rather than quantity of sleep. In terms of the amount of sleep we need, it changes over our lifetime. Where if you look at babies, they sleep a lot of the day, and then children will sleep a little less, and then teenagers, their sleeping habits change remarkably, and then in adulthood, we're probably looking at around about that 6 to 8 hours. Some would say 7 to 9 hours of sleep a night, and then as we get into late middle age, then, or maybe even middle age, sleep gets disrupted for a variety of reasons, usually through biological change, but also just our lifestyle. And then in older age, sleep can be much less and more disrupted.
So Peter, what's your thoughts about mobile phones and sleeping? Do you find it helpful or disruptive?
Yeah, that's a good question. And again, the research kind of changes, not every year, but it seems quite frequently. I think there was concerns that there's a blue light within a mobile phone that is similar to daylight. And if you're using a mobile phone on an evening, then you're giving yourself a blast of daylight when that's not what your brain needs. It's actually seeking darkness so that it can switch itself off and go to sleep. But as I say, the jury's out on this. There are a number of settings you can have on your phone that dampen down the strength of the screen light, and you can turn it to like a warmer amber colour. And there are various apps you could download to dampen the screen light. I think what is the stimulant effect of mobile phones is more around what people are doing on them, looking at messages which might be exciting, might be things that you dread, disappoint. Whatever they are, they'll have a stimulating effect on you. The time when you don't need to be stimulated, other people will be on various games, apps, all of these, or checking the internet for the latest football score. They'll all have a stimulating effect. So it's probably very similar to having a cup of coffee or tea or a cigarette. All of these things need to happen much earlier in the evening. Put down the caffeine, the nicotine, and the mobile phone, really. All of those are stimulants, not good for us.
Yeah, and I suppose you just get in the habit. If you are having a restless night, that's the first thing you go and pick up. But if it's not by the side of you, then it kind of eradicates that that habit, doesn't it?
Yeah, and would you reach for a cup of strong coffee in the middle of the night? No, because it would wake us up, and therefore having even a quick look at our mobile phone might be having that similar effect. And so we've got to resist it and sit with not knowing, that uncertainty.
And I think as well, I know a lot of patients have mentioned it's, when they're dealing, which I know we've discussed it in our podcast, uncertainty, the first thing to start looking at is Dr. Google and start putting in symptoms. And if you want to find something bad enough, the internet's there to give it to you, whether or not it's absolutely, got no evidence based behind it, and just reinforces that worry and uncertainty.
Yeah, I think the internet is a blessing and a curse. It works for us sometimes and can be it can cause havoc at other times.
But then I suppose the other flip side is the positives, is that sometimes these phones have got some really good apps attached to it as well, which I think we've discussed before. But can you just give us a little bit more information about the ones that maybe you've sourced before?
Yeah, I mean the two that come to mind that patients have found really helpful. One's called Sleepio, which is a dedicated sleep app developed by researchers from a sleep institute. The other one is Headspace, which is a meditation-based app that has a vast library of different meditation courses that people can practice on from the sort of foundation level of learning to meditate, and then more advanced ones about managing stress, depression, improving performance at work, and one also on sleep that can help improve the quality of sleep. And then setting aside apps, there are bedtime stories for adults that can help just allow the mind to focus away from the day-to-day life and to move to something that is not stressful and not consequential to the person, but might just catch their interest enough to take them off to sleep.
That's great. Peter, there's a lot there to discuss and to ponder over, and some really, really good strategies that I'm sure we can all use. And I think, again, the emphasis is that, we all try and challenge ourselves each day to look at improving our diet or maybe exercise. But, I think one of the things that it needs to coincide is sleep is so valuable. And I think, from a cancer point of view and recovery, or even during treatment, it's something, to really, really consider, and to put in as much work with sleep as everything else. So yeah, would you agree with that?
I would, yeah, absolutely. And it's aiming for that quality of sleep. That's the aim, really. And removing behaviours that might be disrupting sleep and introducing behaviours that can improve it.
Yeah, I think it'll be very valuable, and thank you very much for coming today. Thank you, Peter.
Thank you for inviting me.